Now let's move to the third ILO, which is about the red flag signs of cancer. And by red flag signs, it's meant to describe a status with possible or probable evidence of serious medical condition that warrant immediate referral or immediate investigation. Any combination of persistent or unexplained pallor, fatigue, and malaise, fever, recurrent or treatment-resistant infections, or hemorrhagic diatheses should be evaluated with complete blood count and blood smear. Anorexia and weight loss, which is unexplained, and if accompanied by significant weight loss or other suspicious findings like recurrent infections, fever, pallor, that's marrow infiltration, or lymphadenopathy, hepatosplenomegaly, would raise the possibility of cancer. Similarly, whether generalized or localized lymphadenopathy, when persistent, progressively increasing, the consistency is firm to hard, attached to surroundings, not tender, and when lymph nodes are present in a special location would raise the possibility of cancer when it's present in the supraclavicular or the epitrochlear region of cancer. The red flag signs for headache would be headache that is of acute onset, that's persistent, awakening the child from sleep, not responding to painkillers, without a family history of migraine, especially if associated with manifestations of increased tension like vomiting or neurologic deficits. Similarly, you have to exclude a brain tumor in a child who presents with acute onset and progressive course of school performance deterioration, personality, or mood changes. Similarly, a patient who is presenting with palpable abdominal mass or hepatosplenomegaly or vomiting, bone pain or joint pain, limping or refusal to walk, back pain or spine anomalies, masses or lumps on extremities, urine retention or enuresis, scrotal swelling or scrotal mass, gingival swelling or gingival bleeding, dermatological manifestations, especially eczema or subcutaneous nodules. I'm going briefly to describe the most common types of childhood cancer, excluding, of course, leukemia, which is going to be discussed fully in the second part of my presentation. So the second most common malignancy in pediatrics is the central nervous system tumors. The main clinical characteristics of which are persistent headache, nausea or vomiting, ataxia, disturbed gait, visual disturbances in the form of diplopia, squinting, papilledema, proptosis, and neurological deficits like cranial nerve pulses, motor or sensory signs, convulsions or seizures might be the presenting problem. Developmental delay or regression of acquired milestones, or unexplained deterioration of school performance, mood or personality changes, raised intracranial tension in the form of increased head circumference, bulging fontanelle, or irritability. The hallmark of lymphoma, whether Hodgkin or non-Hodgkin, is presence of lymphadenopathy. Systemic manifestations in the form of night fever, night sweats, significant weight loss would classify Hodgkin's disease into A or B category according to absence or presence of such symptoms. Pallor, fatigue or bruises, abdominal mass, hepatosplenomegaly, nausea and vomiting, constipation, or abdominal pain. Neuroblastoma is one of the embryonal tumors that presents usually with an abdominal mass, less commonly neck one, anorexia, failure to thrive, fever, bone pain, lymphadenopathy, pallor and malaise, leg weakness, ocular symptoms, back pain, subcutaneous nodules, obstructive symptoms of the bowel or bladder, and neurological deficits. Most of cases usually present very late, usually in stages 3 or 4, where the tumor is very huge, causing pressure effects on the surrounding, or mostly in the fourth stage with disseminated tumor, and the sites of predilection for dissemination are the bone marrow, and the lymph nodes. Renal tumors, the prototype of which is the nephroblastoma or the Wilms tumor, another embryonal tumor that presents with abdominal mass, in most cases accidentally discovered. Other clinical characteristics in less frequency are the abdominal pain, hematuria, vomiting, constipation, fever, and hypertension.